All right, everyone. Good afternoon and happy Friday. We want to thank you for joining us today. A special thank you to our veterans, as always, for your service. This is your meeting, so we're going to do our best to keep our updates brief, but important, and then we will slide right into the Q&A. We'd also like to give a special thank you to our staff who joined us today for an education fair. So this is going to be the cadence moving forward in FY26. We will move to other VAs. We will publish our locations and times in the next 2 weeks on our website, as well as send out a Gov delivery message. So be on the lookout for that. And if you're not subscribed to our newsletter, we'll make sure that you have the QR code or the link before the meeting is over today. Want to remind you, please avoid sharing any personal health identifiers during the meeting, especially during the Q&A. Because we will share this meeting broadcast on our Facebook page. We'll do our best to edit it, of course, before sending it out. And that's all I have right now. I'm going to turn it over to our fearless leader, Mr. Kai Mentzer. Thank you.
Thanks, Chanel. Thanks. That's all right. No. And you can go to the next slide, too, sir. Yeah, I don't need anybody staring at my picture. I've got some talking points here, but before I get started with that, I want to make sure when we do get out the schedule for this year, we're going to try our hardest not to change it. So she's happy about that. This year, I might have got overly aggressive. I've got some feedback that we should come visit the clinics, and then we visited the clinics. But that old schedule was still sitting on the veterans' desk at home, and they showed up to a different place than where we were. So we're going to try and stick to the schedule that we put out. There's a lot of requests. I can't please everybody. I know that. I'm still working on that. Some requests to come on weekends, some requests to come on nights, some requests to come to other clinics. We're trying to get the most out of our time. So when that schedule does come out, I'll have reviewed it before we send it out to make sure that it makes sense. All right, the secretary came to visit us last week. That's a big deal. I have to explain this to my 13-year-old and 11-year-old at home. The secretary reports directly to the president, and he decided he was going to come visit Atlanta last Friday. So he and two senior leaders of his team, one that I've kind of grew up with in the VA and known very well, stopped by. And when they stopped by last week, they arrived early in the morning and they left late in the afternoon. And the secretary's first real question for us was, how can I help? What's not working? What's on the top of your priority list that you want to work on that maybe you can't manage as a director of a large healthcare system? And so my answer was pretty easy. It's the first thing that came to my mind, and that was to give me the autonomy to do what I need to do, to care for our patients and hire the staff that we need to hire. And so in the next slide, I'll talk to you a little bit about that. You can go back just for 1 second. It helps me guide through some of the comments. The secretary shared immediately after our office, I think he went and did some hunting actually down in Dublin. We talked about that for a little bit. But then on Monday, he attended the Military Influencer Conference in Atlanta. And at the conference, he did a town hall. And one of the hosts of the town hall asked him, how the visit was at the facility. And he shared he shared that he had trust and confidence in the leadership team, which that feels good to hear because it's not always the case. And then he asked for some patience. Last town hall, I talked about how we grew last year by 1,000 patients a month. We're slowing down. We're only growing by 800 new patients a month, which is an entire new clinic every month. And we don't have the ability to build infrastructure for that, which is really the challenge. Is I can't just build new space. I can't just hire new people immediately overnight. And so the 5 or 6 people I've talked to already said, when are you hiring new doctors? And it's just really hard right now. And so part of that conversation with the secretary last week was to not only let us hire those doctors, but help remove some of the barriers to getting them on board more timely. So it felt good for him to hear that. Next slide for me. So this is one of the things that we showed him. We're constantly trying to improve everything, keeping the veteran at the focus of what we do, and mindful that I don't get to decide sometimes. Some of it comes out of White House, the secretary's office, or above me on how we're going to function. But we brought him into a room with 5 major projects that we're working on. And this is the most senior leader in the VA, and he got down into the weeds on some of the projects, asking us, well, why is that a problem? What are you doing about it? Why is that a problem? What are you doing about it? And some of them were very uncomfortable answers because the problem actually came out of the White House. And so I had to describe to, a very senior leader that we're facing this issue with getting our radiology exams read timely because somebody decided that the radiologist couldn't work from home. And when that was decided, people started leaving the VA and go working for the private sector where they could. They're not my employees, but they are the VA's employees at the national level. So I had to describe to him, these are the challenges that we faced when those decisions were made. And so when he asked for, what's your most important thing, that autonomy to make those decisions locally is what I really need. So it was a really good engagement. I think he learned quite a bit. It tells me that when he went to that show on Monday and talked about how much trust he had in us. We talked about the bottlenecks in our emergency department. It is completely unacceptable for the veterans, for you, for me, for any of us to go there and wait hours to get a bed or to get seen and get the results that we need. But part of that challenge is this environment where it's really tough to hire for one reason or another outside of my control, right? We've got authority. I've given authority to hire more than 1,000 people, but now I'm waiting on those people to come on board because of these administrative processes that are driven by HR outside of my facility. So I was able to walk him through some of those things. I think he learned just as much as we learned as an organization, as a team, and growing and building that trust with him. The culture change at our hospital is what's needed, okay? It's not you've got a new director who wants to improve things. It's not, you've got a chief of staff who wants to improve things. It's the cultural change that's necessary. In order to get there, it's going to take us some time. We're making those changes. I think you guys have seen that. I think just by the fact of us coming up here and having these genuine conversations, I think the availability of me when I am available to talk with you, my team, my chief of staff, my clinicians, that's completely different than I think the way it was before. I was sharing, I think the secretary took a while to come visit with us because he wasn't sure of what he had in Atlanta. Once he started to get wind of what we were and who we were, and then the fact that he said he trusts us and knows that we're going to make these changes is the exciting part. Before I turn it over, this year's focus will be the patient experience. Yes, it's sad that wasn't last year's focus. Frankly, last year I think I was just trying to figure out, where the bathroom was. This year's focus is going to be patient experience, and I don't just like to use words, I like to do actions. So we've been talking this entire week about accountability metrics for the frontline staff and the supervisors and managers and service chiefs on how do we recognize when it's working and when it isn't. And some of the other directors in the country who do a really good job with this, I've already reached out and talked to them, and one of them told me every day they look at the comments from the patients from yesterday and they address that concern that morning. So if a veteran said when he walked into the pick a clinic and the person was not nice to them, we try to reach out to that patient and say who specifically wasn't nice because we want to have a conversation with them, right? And after a number of conversations, that turns into accountability, right? And that accountability can be whatever that supervisor determines for it to be. But for me, it's just not acceptable to have multiple occurrences of those issuances. This gentleman shared with me at one of the clinics, they wouldn't let him in with a flag. Like, now that I know that, I can follow up on it. The key for me is to get to know it so we can work on it. Sometimes we get things like from 3 months ago, and then I call my veteran, and they're like, I don't even know what you're talking about, right? So we've got to get more timely on those things. But the actions that we're taking is we've dedicated a single individual in the organization to really help guide us on this, and she starts for the facility next week. She's going to be an experience officer. She will be front and center for everybody. She'll be at these town halls. She's going to be engaging with our offices outside of the VA. I know we do our quarterly VSO meetings, but she's going to help us do a better job of maybe getting out more often. So, all right, I think I've talked a lot. Next slide, I think, is... future expansion. Oh, yeah. So half of the function is the hospital. The other half is that strategy for me. We've been meeting with senior leaders that have come specifically just to Atlanta because of our growth, and we've found money that's reportedly going to be set aside for us. I haven't seen it yet. That's going to help grow the organization. Over the next 10 years, we're going to be growing. Thank you. We're going to be adding 12 more clinics. 10 years, 12 clinics, that's the plan. So we're starting already to do that. The money has to come with it. Clinics all over our catchment area, a new CLC, a new women's health clinic, another CLC in the south, and then some more, a couple of these kind of clinics and some smaller clinics, just some normal CBOCs. So we're expected to go from 22, which is the most in the country, to 32 as we continue to grow. So Mr. Minley was here last month, or last quarter, sorry, and he shared some of the infrastructure updates that we have. All right, look, I didn't wear a jersey today. Today's supposed to be wear your jersey to work day. I knew I was going to be in front of you guys and on the camera, and so I did not wear my Philadelphia Eagles jersey.
All right, thank you, and good afternoon, everyone. I'm going to run through my slides very quickly and depart out of your way. Currently, we are working to replace the dilapidated bridge on our campus. It's been some time. About last year, there was a project to replace it, but then they found some additional structural issues, so we had to cancel that project and go start from square one with a full design. The structural calculations took longer than it needed to, but we have to get that right because we don't want the bridge to fall down. So we've gotten some calculations, and we are progressing forward to the design. The design is at about 35%. We've got to get it to 100% before we can get it to some contractors to perform the work. The next couple slides are just renderings of what the bridge, of some of the options. Next slide. The option that we're going to go with, next slide, is a fully enclosed bridge. It'll improve the aesthetics of the campus. It'll address concerns that staff and patients have had regarding walking in an open air bridge with no protection. So this is the option that we're working towards. And if funding is made available for this, then we will be going this route. Our next project is our renovating our 5th floor. The 5th floor is going to become our new inpatient behavioral health unit. The current unit was renovated back in 2007. It's kind of aged. The environment of care requirements has changed. So we want to be in compliance with the new requirements and to design a home-like environment for our behavioral health patients. So that's also in the early stages of design, 15%. So we are also committed to upgrading our high-cost, high-tech medical devices throughout the healthcare system, one being the cath lab, which is currently in design. We're supposed to be done with that design this month, and the estimated completion for construction is October of 2026. So we're also expanding access at our Trinka Davis campus in West Georgia, Carrollton. We're going to be building a 12-bed CLC pod on the campus. They already have 4 pods out there. Veterans rave at the quality and the ambiance of that setting. So we're going to be building another 12-bed pod. We are on the cusp of awarding that contract. It should be awarded before the end of the month at about $13 million, so we should start to break ground sometime this year. This is just an interior view of what the pod is going to look like. Lastly, we are working on upgrading our elevators on campus at the main facility. We have about 20+ elevators on campus, and they're all in different conditions, so we're renovating, replacing, upgrading, and updating. And that's it.
Thanks, Mr. Minley. Next, we'll hear from Mr. Jamichael Minora. He is our permanent assistant director, but currently acting for Dr. Kendra Lee, the associate director for Access.
All right, so we are making progress in terms of our length of time for care. So we have 30 specialties that have been positively impacted by this change. So if you're looking at this, so COC is standardized episode of care. That is what the system we use to bundle all of your care together based on the specific veteran needs to mitigate the need for you going back and forth between different appointments. So those changes to improve your request for services process. So under the new 1-year reauthorization policy, these specialties, you would not have to go for another authorization for these 30 specialties right here. So key takeaway from this is that the VA is encouraging veterans to contact their VA Medical Center's Community Care Office for more information on the new policy. Which brings us to our next slide. Best way to contact community care is through secure messaging. So that is the absolute best way to do it. All right, so go to secure messaging, ask community care a question, and then from there, They review all of those questions or concerns that you have on a daily basis. And if you need to contact Community Care by phone, make sure you take down, and we'll provide this information to you. This is the new number and the new extension for Community Care. So the one that was posted in the past is not the correct number. This is the new one. We've already updated it. So make sure you take down this number. And like I said, we'll make sure it's disseminated to you. All right. Thank you.
And while you're taking a photo of that, our community care timeliness has significantly improved. So the last time we were here in March, it was taking 51 days to schedule an appointment. 51 days just to talk to you and get an appointment in the community. Then it was, now that appointment could be another 3 weeks, 4 weeks, a month out. Now they're down to 31 days to schedule an appointment. And they're continuing to improve. So they decreased by almost 3 weeks. Okay, 3 weeks. They're continuing to improve those numbers. But part of that is your assistance by answering the telephone, because on average, they have to call a veteran like 1.7 times. I know, how do you call somebody 7 times? 0.7. On average, they have to call you twice before you answer. And I know, because I get those phone calls too as a veteran. So that helps if you can answer those telephone calls from us. When you get a call from us, save that number as a VA telephone number, and that'll help. The other thing that you can do is there's a lot of clinics out in the community that have signed up for external provider scheduling. And so what that does is it allows us to directly schedule into a grid in the community. So when you call, it's called EPS. EPS. When you call, say, is there an EPS provider? And that'll remind us to do our jobs. And I know nobody likes to be reminded, but it'll help you get it done quicker. All we got to do is schedule into a grid. We don't have to call that community provider. We don't have to wait for them to call us back. We don't have to wait for them to say no. We don't have to call you back again. You can tell us right then and there, and we can look on this dentist slots and say, oh, there's one here on Tuesday the 9th. Does that work? And you say yes. We say yes. We're done. Instead of, well, let me call the dentist and I'll let you know. Then we call the dentist and he's like, well, let me look and I'll get back to you. Then they never get back to us. And then you call us and say, no one's answering me. And then we call you. Now you can say EPS. I want an external provider scheduled. And right away they'll schedule it for us. And we're trying to get, we have Wellstar. We have a few others. What we don't have yet is Emory. And that's a big one for us that we've been working aggressively on. So go ahead.
There should be a website for veterans to be able to track in the system where it's at. Has it gone from the primary care? Has it gone to the nurse or the specialty clinic that needs to do it? Has it gone to community care? Has it gone to Optum? We're in the process. So if there's
I love
a
it.
glitch, we can track it. And also, especially for the RFS,
Referral for services, yes.
when the provider puts that in to get more visits or more time, then especially a large one with Emory, I get my eyes.
I love the idea. Almost like a Domino's tracker, right? When you buy something from Domino's, the pizza, you can see it on your move through the progress in the oven, in the delivery guy. Yeah, there's not something in the works on that specifically yet, but here's why. We're transferring over to that new electronic health record system that's supposed to help us with some of this, which also includes the RFSs, or referral for services. So if you're not familiar, when you go to the community and that provider's like, oh, you also need this, they have to refer back to us to help you get that care. It's actually something the secretary talked to me about when he was here last week. He said we're trying to improve that. And I kind of wanted to ask a little bit more about it, but he talked a good bit. So I couldn't get a word in for that one, but it's something that they're also working on, I think.
Along that lines also is if there could be some kind of notification or through the website, if one was created, that would notify us when our referral, our authorization was about to end, so to make sure that we don't have I had an appointment once that was 2 days after my referral and my authorization had ended, and I just got missed in the system. I usually try and track
That's
it
a
really
good
close,
idea.
but it's,
Okay.
if we could have some sort of
That's a
notification.
good idea, too. Yeah, that's a great idea. All right. Go ahead, Chanel.
I was just going to say we'd like to hear from Ms.
I know.
Ramos next. We're going to get to community events. Then we're going to hear from VBA, and then we'll get to the Q&A. So if you could hold, the veteran in the green shorts is going to ask the first question before he heads to South Atlanta. All right, we can move to community events for Ms. Ramos.
Hi, welcome again. Thank you. My name is Gwendolyn Ramos, and I'm the Chief of Voluntary Services, CDCE now, Center for Development and Civic Engagement. Thank you all for coming. If you want to take a screenshot of these events that are coming in your area, they will further your education on disability benefits, claims, and resources that you may need for a family member or caregiver. So please take a picture of that. Our next big event is coming up in Cobb, October the 20th, 21st in Cobb. It's at the Marietta, off of Marietta at the Cobb Civic Center. Okay? Any questions, you can see me after.
What event? The 20th? I didn't see it. Go
It's-
back one.
I also dropped it in the chat for those who are joining us online.
It's a Marietta event. It's probably on the second slide. So
Let's see.
it's the Marietta event. It's October the 17th at Cobb Civic Center. It's from 9 to 4, okay? And just in case you seeing everyone in their jerseys, or we're boosting morale. So happy staff, happy customer service, right? So anything to make your service and your visits here better. Thank you.
Ms. Ramos, is this the We Care Vet Fair? Yes, sir. Okay, so let me just clarify for y'all, because it was, the date was stated wrong twice. It's October 21st from 8:30 a.m. to 6 p.m. at the Cobb Civic Center. And it's benefits, legal service, healthcare, mental health, community, and wellness, okay? So if you're, there was a lot of folks that had asked or shared, October 21st, Tuesday, at the Cobb Civic Center. Thanks.
Next, we will hear from Ms. Sharon Thompson of the VBA and get right to the Q&A thereafter. Ms. Thompson, you're up.
Good afternoon, everyone. My name is Sharon Thompson, and I'm one of the Assistant Veteran Service Center Manager at the Atlanta RO. So today, I'm going to give you some updates on what we're doing to serve our veterans, nationally and locally. Before I get to that, let me talk about, and I'm going to talk out of order, backlog. So Doug Collins, he has made a promise to reduce our backlog substantially, substantially by December of 2025. And let me tell you what we're doing to do that. So we're working overtime, voluntary and mandatory, where our processors are making sure we work the claims and get them to the next claim cycle to get you your benefits. Go back one. I'm going to give you some numbers. So these are the distinct claimants that we've served for this FY, 99,160. We've completed 123,000 claims this FY. Processing time, we're working on that. We're at 159.4. Claim grant rate, which is important, we're at 70.9. Claims granted, 87,000. And pending claims, we have 12,334. So, but the big thing here I want you to take away is the sum of awards. This FY so far, we have completed 506,689,856 awards. So as you can see, we're working hard to serve you. You can go back to, okay. So let's go back to backlog. And let me say, this morning we had a meeting, and in that meeting, we were told that before the FY, we will complete 3 million claims. So in speaking to backlog, those are the claims that are pending over 125 days. As of September 11th, the national inventory for backlog is at 653,049 claims. Of those, 144,644 are pending backlog, with a 22.1% of the total inventory. At Atlanta, the inventory stands at 6,023 claims. Of those, 1,157 are pending as backlog, which is 19% of our total inventory. Next slide. So this is something that we're going to transition to. Everyone know that we're currently using e-benefits and the stakeholders portal to submit to submit dependency claim. your 2122 to your POAs. So we're going away from that. Next slide. As of September 17th, this is already in progress. This is a new process that we're going to be using to accept claims. So as of the 17th of this month, this new process that we're using to submit dependency claims and stakeholders claims is going to change to the new process, is what I'm saying. The process is already underway. In October, we're going to transition, and we're no longer going to use e-benefits and the stakeholders portal. November, December, those two systems are going to be decommissioned. Anything that's pending in those two systems, we will complete. One other thing that we're doing at the VBA is we're going to have a self-check-in kiosk. When you guys come into our public contact area and you're submitting claims and you're wanting questions about your claims, you can check in at this portal, and it will significantly reduce your wait time. So those are some of the things that we're doing. So if you have any questions at the end, I'm more than happy to help.
Thank you. This year, the VBA, I meet with the director over at the VBA regularly because they don't work for me, they don't report to me, but I meet with her every month, and she shared early on that the secretary's changes might not be good, but all of a sudden they started to get more done with less people in less time. And I think it was a centralized focus on this set of benefits, then focus on this set, then focus on this set. So what she shared with me is that they've been more timely this year than ever before. So I'm pretty excited that as a veteran, that those claims are getting processed quicker. I think our next slide is the question and answer for the gentleman in the green shorts, sir, who's going to be traveling down to Atlanta.
Yes. So this is my issue. I know you said you want to hold everybody accountable. So recently, I filed an issue with Patient Advocate. So I went in and I filed a complaint with Mark Jenkins. And when I had the issue, I filed a complaint, and he said 7 to 14 days. So for 7 to 14 days, I sent an email. He told me he had no idea what was going on. Then Community Care called him. He said he had no idea what was going on. So how do you hold them accountable about helping the veterans?
Through this.
Yes, because you tell them they have no idea what's going on, because you need to put them on Beat Street and hold them accountable. So when he called his other manager, Emily, down, she came down and was very, very combative with me. And then she went up to the director's office and told her supervisor not to come down to talk to me. So I haven't received a call. He acts like he doesn't know what's going on, because I emailed him to loop in Community Care, and I still haven't got a response from him because he acts like he doesn't know what's going on. How do you hold, if you're going to change the culture, you need to hold them accountable.
I agree.
Because if you're going to throw out the old guard, hold them accountable. Have them to say, well, this is what it's going to do. If I'm going to come in there and as a vet, tell them to say, okay, this is what's going on. I email you.
I got you, sir. I got you.
So hold them accountable.
Here's one thing that I'm good at, not repeating, right? Because if he speaks for 10 minutes, then you don't get to speak at all, because there's a time limit. I got you. This is how you hold them accountable. You tell me, then we have a conversation, right? What I will tell you is you cannot fire everybody, because then I ain't got nobody, right? So, yes. So give us the instructions. Let me give you my email. And you can email me anytime, and I respond to 100% of them. 100%. You ready? It's my first name. Can you go back to my slide? I know it's way back at the beginning. It's this dot Mentzer. The number 2. If you want to take a picture with my finger there. As a reminder, the number 2. It's Kai.Mentzer, the number 2. Get rid of the D. Okay? Kai.Mentzer, number 2. Email me, and I'll follow up. Now, I'm not saying this about green shorts, all right? But here's what I'll say. At va.gov, yes, sir. Here's what I'll say, okay? I thought I was going to be a mathematician at one time, so I like to use numbers. I would estimate that's 2 out of 3 times the real story comes out and there's a real issue. Okay, and it's not always that one individual. It's usually bigger. I've had a veteran recently that has acquired $40,000 worth of wheelchair items this year alone and is still complaining that we're not providing care. Okay? So I started off this conversation with, I know I can't please everybody. All right? Different than yours, okay? Completely different. But you see where I'm going? Like, thank you for the email. Let me look into it. And guess what? I get an email every week from that veteran. It's Kai, K-A-I, dot Mentzer, M-E-N-T-Z-E-R, the number 2, at va.gov. I get an email every week from that same veteran. I do not respond to her every week. Okay? Because I've gotten to the root cause of it. I know where we're at as an organization. We've done everything correctly. But what I am required to do is write her a letter every single time, personally sign it, and send it to her house. So while I'm doing that, I may not have the time to meet with you every day. Do you get what I'm saying? This is a requirement that I have to do. Again, if you give me the autonomy to lead the organization like I see fit, I will not be responding to her every week. I've resolved her issue. I'm moving on. Okay? Thank you for the concern. We'll take care of it. Hey, whoever's got the mics, don't give them to them. Like, just hold on to it because they'll talk and talk and talk. Go ahead, ma'am.
Yes.
Hey, great to see you.
My question is about community care.
Yes.
The authorization, once issued, and I understood you're saying that, the calls, you're calling back and forth. Why not have, and this happened to me.
Okay.
Just calling back and forth, telling me, you're in the queue, you're in the queue. Finally, one of the employees said to me, Mrs. Walker, do you realize that you can make your own appointment? And I said, no. He said, he gave me all the authorization information. I called, I had an appointment in less than 5 minutes. Why can't we put that into the system, letting them veterans know?
I didn't know that, actually. I'll do it. We'll do it.
Okay.
Help me, though. Help me get this message out to your constituents, right? When you go back and meet with them. Because we send a lot. I mean, I get these messages. I get like two a week or 2 a day. It's like a lot from the VA, so you stop reading them. Start looking for the ones that say Atlanta. I know Chanel, my chief communications officer, is upset with me. Start looking for the ones that say Atlanta VA so that when we do send something, it's intentional. I review all of them to make sure it's intentional, and we're going to have to get that out to all the veterans because that's a great find. Thanks for that. And it helps us because we can't hire 1 million people because then your taxes go up by $1 million. So if we can do this smarter and be more efficient with it, then it's going to help all. Yeah, great. I appreciate that one very much.
So on that note, I just wanted to add that I got a letter in the mail. That was a song, but anyway, I got a letter in the mail, and
She said that was a song.
that was a cadence, wasn't it? Y'all don't remember? Got a letter in the mail, go to war, go to jail. Anyway, but I got the letter, and then I tried to call the number back multiple times, and then the next thing I know, I get an email from secure messaging saying that it was over, that they had deactivated it, and I had to go back to my primary care. And so I didn't know that they close at 4 and that you can't call after 4. That was nowhere in the letter. Yeah, so there was nowhere in the letter that they stop at 4, but I just emailed her back, and I was like, I was just hoping that I would have a little bit more than 3 weeks to respond since I've been calling you, and you have no way of knowing that I've been calling you back.
Okay. The letter thing came up this morning. It continues to come up. Our Associate Director for Operations, Mr. Menorah, shared this morning they're going to do a systematic approach to review all the letters that we have. The way it works is that inside the computer, inside CPRS, every doctor can create their own letter. So we've got to the culture, and Mr. Greenshorts, to the culture of the organization, what we need to do is we need to figure out how to systematically get in there and stop that. And we haven't quite figured that out yet. So we're trying to overly communicate constantly. If you've got a letter, please look at it. Make sure it's the right telephone number. Make sure it's got the right contact information. Make sure it's got the right director signature on it, because some of them still have the old directors. And we're slowly working through that. So every time that kind of thing comes up, if you guys want to let me know, I'm serious. Just email me and I'll help figure that out. And I wish there was a better way to do this than this, but it's like any other customer service in the organization in the world. The only way that I could fix it is if I know about it. Okay? And I want to get comfortable knowing about it myself so that I can ensure that there's a sustainable solution in the organization. Go ahead, sir. She's trying not to give you that mic, isn't she?
Two quick things. I get letters after my appointment telling me my appointment was last week. Okay?
Me too.
Okay, just saying. And then the other thing
That's
is,
because we mail our letters, I kid you not, from Alabama.
well, I've seen that. I know. So the other thing is,
It's cheap. It's cheaper. It's
the
a VA in
30
Alabama. They do a great job mailing them out, but
lot-
we get them
Right.
mailed from there to Georgia to us. First thing y'all told me when you got here, and I know, is the mail system is terrible in Georgia. So
Right. The other thing is, there's a confusion, and I talked to the two ladies that know in community care about the 30-minute drive time. Several of our members have been told by VA staff there is not a 30-minute drive time for community care. It's so many miles. But these young ladies here told me today there is. So that needs to get out to people that are being asked the question, especially your staff in all the clinics and some staff in community care, because they don't understand it.
yeah, we'll work on that. It is. I tried to argue with it because it's Atlanta, and now that I've lived here for more than a year, I know that the mileage is not even appropriate. Here's what I was advised, and you can talk to your congressman, because that's where this comes from. They decided when they did the Mission Act standards that they would use 10 o'clock on a Tuesday morning as the standard. Yeah, you're telling me. So, I mean, I got pretty upset about it. But again, I don't have the autonomy to change that. And so I'd asked if they'd do a review. Now, I know that they're re-looking at all of the community care again. They're trying to reissue a contract. It's going to be probably $10 billion worth of community care. But I would love to see something different in there for that for us. Yeah, great question.
Yes, my name is Shirley, and this is regarding community care. And this is just an observation. When you get a call from community care and whatever service you're looking for, they sometimes just give you a doctor's name. I don't think that they're allowing people aware that there is a website that they have. It's very difficult to find, and you can look for doctors. Because me personally, I want to look up the reviews of the doctors
Yeah.
to see if it's a doctor I'm interested
Yeah.
in. So that's my concern. Like, they may give you a doctor like in proximity to your home. That's what I've noticed. Like 2 miles from my house.
Yeah, that's the first thing they try to do is make it, we've been coached and mentored for years to say, let's get you something closest to your home versus, so we can work on a message to that link that you're talking about. If you want to share that with us, specifically what that link is. I see my chief of community care in the back listening in on me though.
And also on that
Shaking her
link,
head, yes.
that link, we want the providers to be updated because you'll call and they are no longer. You'll call these
Okay.
providers and they're no longer available or they're no longer in the VA system
Okay.
as far as a contractor.
All right, thank you. I want to, there's a lady right here in the stripes, yeah.
Well, I just got here.
I know, we told them not to give you the microphone because you guys will talk.
I listened in the car, though, so I was paying attention to what you were saying. I want to say something kind because I'm in the PRRC.
Oh, she's going to say something kind. Just give her the mic and we can just sit back and relax.
I absolutely love the team that we are working with. I love all the classes we're taking.
Which team is this?
PRRC.
Okay, thank you.
Yeah,
Yeah.
and I
I
want
knew I knew you from somewhere.
Okay,
Yeah.
I want to make sure I say some
Huh.
other thing. I've used the secure messaging. I have had no problems. I know everybody has different situations,
Yeah.
and maybe I'm not getting on as much as somebody else, but every single time I'm Dr. V's patient, her nurses, somebody gets back with me immediately. I have not had the same experience, so I want to say some people don't fall through the cracks because it's working for me. I love the people here, down there that's doing the registration, whoever's back there, physical therapy. I have not experienced the pain some other people have. I simply want to say thank you.
Thank you. Thanks for coming back in here. I appreciate you coming back in. Go ahead, sir.
Every large organization have centers of
Excellence. Yes, sir.
What are you doing to tap into that and capture some of those nuggets
Oh, wow.
so that you can share it and make our lives a little bit better?
What'd you do before? What was your career? I don't know how to ask.
Quality.
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 Yeah. Yeah, you're hired. Where's it? Great. Yes, sir. He's like, I don't know if I can. This is important to me because it's important to me that we constantly change for the better. So I'll just give you a couple of the probably 25, 30 different things that we do in our organization. One of the biggest things is that we have networks of excellence. So our quality department meets with other quality departments to say, what did you do for this that just came up? In the last few weeks, we've been having some issues with our instruments in our SPS area. So we had the experts from our regional office come visit with us, and then we have 7 other hospitals in our network. We reached out to those other hospitals and said, have you guys ever seen this? What's going on? What'd you do? And they gave us, yes, this is something we've tackled. And then they sent us their staff. And their staff are going to come in this weekend and help us out. So that's something very local that we work on. We also have, VA is phenomenal for this. I mean, better than the private sector for sure because of the network that we have. We have a national innovation office where we all can reach out to, and specific hospitals, this year I've applied to be one, specific hospitals can get free staff to come work at the hospital who then become mentored, led, coached by this national innovation office. One of the other things that we do is, we all went to directors, all the CEOs of all the hospitals, roughly 150, 200 of us went to Dallas, Texas over the summer. So the secretary just got into office and he's like, I want to see all the directors. Brought us there to talk to us, and a lot of the directors were complaining. They were like, well, there's no there's no community of practice for the directors. How come there's no community of practice? So my boss was sitting next to me and he kind of elbowed me, and I was like, that's actually a good idea. I think that would work fantastic. Well, there's one director in the country now that's leading that call every week, and you're looking at him. So I stood up the call on my own, reached out to all 200 directors and said, would you please attend this call? We're going to start having senior leaders on this call, experts get on this call. It's only going to be us. It's going to be very secure, and we're going to be able to ask the questions of the people in central office making these decisions and share information with each other on best practices. So that started about a month and a half ago now. Those are just some of the simplest examples. We have a couple of centers of excellence in the Atlanta VA and share those with others across the country. I mean, the VA is one of the best performing networks in the country for a reason, and that's because when we have an issue, there's a mail group that you can just email and you'll get answers instantly for everything. Everything. To include patient experience, to include hiring, to include clinical care on what's happening to a specific veteran. I mean, it's really phenomenal. But that's why, we take quality so seriously in the VA, right? Most VAs are 3, 4, and 5 stars in CMS when most private hospitals aren't. We publish that information regularly across the VAs. We just got our 3rd star this year with a goal to get to the 5th star in 2 years. And it takes 2 years worth of data to get there. Our biggest challenge in Atlanta is the patient's experience. You can get to 4 stars by doing the right thing every day, by taking care of the patients, improving their quality outcomes, but you can't get to that 5th star until all of you like us. And so that's our goal. Yeah. That's our goal, is to make it so that you got your perception of the experience is improving. Go ahead, sir.
How do I give Waker a good, that man is the best. Waker. He works for you in community care.
Waker in community care. Dr. Hollis is our acting chief of community care. We'll make sure she go. I'm sure that's a rare name. We'll know who he is. Okay. Yeah. I'm sorry. Go ahead.
I like to say something kind about community care. I've been doing community care since about 2012 at 3 different VAs, and it has improved a lot. Yes, there's some tweaking that still needs to be done, but I once spent 6 months calling almost daily to trying to get through to community care, not to talk to somebody. And the main thing is here in Atlanta, they were located in the federal building behind closed door. You couldn't get an appointment, couldn't do anything to do a face-to-face. So I would like to see, in addition to a website, a liaison office at the main VA, that even if it was by appointment, that you could go in face-to-face and talk to somebody if you have a problem.
We can work on that.
Yeah, and
Yeah.
I once was approved for surgery. It wasn't a life or death type of situation, but I was approved for it. No one notified me. I finally went into the surgical office and said, when I thought I was going community care, haven't heard anything. And they said, oh yeah, you've been approved for community care a year ago. And I was never told that I could go get that done, move ahead with it. So that's why I think the website.
We are getting better at it. One of the things that we can do to make sure that those kinds of things happen is that we look at we look at you every 30 days now to find out where are you at in that scheduling process, follow up with you on a telephone call, do a clinical review, and then move forward with scheduling. That's actually why we're improving. Yeah.
There is improvement. And getting through the secure message, this was one of the problems was before secure message.
We've made a huge focus on secure messaging and also answering those telephones. But we've just got some numbers this week that I think, based off of a center of excellence on how many staff you should have in a specific area, Atlanta was chosen to be a pilot for how many staff should you have in community care. And I'm hearing that we are half-staffed. Half-staffed. I mean, I try to simplify as much as I can. It's like knowing how much, if you've never worked out, never been told about nutrition, how much should you eat a day? You don't know. You just eat until somebody comes along and tells you you've been doing it wrong. So we start programs like community care and we just grow and grow and grow and grow, and still we're not doing it fast enough to be able to meet the needs of the demand of you all. Yeah. Thank you. I appreciate that.
One thing about benefits, QTC needs to go away.
What's QTC?
They're the
technical
outside
the
doctors
CMP.
or whoever they are. I put in for a claim. I'm 100% though. I put in for a claim, and then I get a call from QTC, supposed to be a 30, 40-minute thing.
They do the physical exams.
Yeah, well, not on the phone.
Okay.
And she says, well, do you have this problem? I said, yes. And I said, did you read my file? No, I haven't read your files. Right after that, I get a letter said your claim's denied. Agent Orange didn't cause it. It wasn't prostate cancer. It was a secondary thing.
Mm-hmm.
And now I got to get a nexus letter from my urologist and all this. I mean, it's stupid. I mean, what I got is,
QTC.
Agent Orange from either the water at Camp Lejeune or prostate cancer.
All right. I'll follow up with our VBA counterparts about the
'Cause
QTC contract. I think it's a nationally driven contract. I don't know that we can change it, but I'll bring that feedback back to the Secretary's office. All right. All right. I'll bring that back to the Secretary's office if there's an opportunity. And VBA said they want to see you. You're in trouble.
So for VBA, so you don't cover the VBA. So if you need to talk to somebody because you're having, and this is a question that somebody just texted me. So if you have a question for somebody in VBA, who is the person that you can go to? Like, who is your counterpart at VBA?
There isn't one. Yeah, I don't have responsibility over the benefit side of the VA or the cemetery side, just the healthcare. There's not one. There's an acting one, but she's actually 2 layers lower than the permanent one that's supposed to be coming. Can we ask her who, if maybe she'll know? I don't know who. Angela Sealhammer. Okay. Is that angela.sealhammer@va.gov probably? Yeah, I'm seeing head shakes. Do you want me to give that to you? Angela, Angela, dot Sealhammer. That's SEELHAMMER. I'm going to say it one more time. Is that right? SEELHAMMER.
I'm from Decatur. Question, women's wellness.
Yes, ma'am.
Women's wellness, we don't have an MD anymore. So, yeah, they took the MD to Clinic C.
Is that
So all we have is
okay?
a nurse practitioner. What are the plans?
The plan. There's Miss McLaughlin. Thank you, ma'am. Go ahead.
I didn't get the whole question.
She says, when's the plan to get an MD for the which clinic?
Women's wellness.
Women's Wellness.
Okay. Hello?
Question is,
Wait, she's going to answer your first one so we can.
Hi, I'm Kathleen O'Loughlin. I'm the Women Veteran Program Manager. So the Women's Wellness Clinic is in the process of hiring new clinicians and doctors to replace the ones that left.
let us know that we don't have our doctors anymore. No letter came out or anything, so you show up for your appointment and you find out this been going on since June. And nobody notified us.
Okay, I'm so sorry about that. And if you wouldn't mind coming down to the table with me so that we can try to remedy this and get you the information.
All right. What's your second question? She got a second question.
It was
Okay,
about the
thank you.
notification. Well,
Okay.
notified.
No, that's a big one. Yeah, we should notify. We'll have to find out what happened because I know we do it, so we'll have to find out where the gap is. Yeah. Yeah, thanks. Someone else. So let's talk about the women's. Well, before you leave, though, the secretary gave us a special project. The secretary, before he left us on Friday, said, I would like to pilot this across the country, but since I'm here, can we just pilot it in Atlanta? And pilot is like testing. And the test is to direct schedule our female veterans into the clinic. So instead of the referral process of getting you into the clinic, you can just, like audiology, you can direct schedule yourselves. So we're looking at how we can implement that quickly. He wants it done by Wednesday next week. I know. That's what I'm saying. It's like, so we're on it, is right. Everybody's on it. Yes. So the good news is that those are the kinds of things that he wants to do. Is like, why do we have to go through a long, lengthy process? The private sector doesn't do it. Why can't we do it? To her point about looking online and seeing providers, my wife's not a veteran. She looks online and is like, yes, I want to see her, or yes, that's the person I want to see, and then that's who she chooses to schedule an appointment with. Why can't we do that in the VA too? You know, and those are the kinds of things that when he came to visit us, I was very pleasantly surprised. Like, oh, this is a great idea. Can you help us do this? So. Y'all are doing great with questions. Hey, there's a full set of tables out there if you had an opportunity. We're going to do this at every single town hall because I know a lot of the things are going to get taken care of out there before you come up here.
Yes, I was glad to see the 30 items, types of care that you've done for a year.
Okay.
Authorized for a year. But
The secretary did that.
Okay.
I just listen to what he tells me. That's I thought it was awesome. It helps the community care staff. They don't have to do extra work.
Right, I agree. Well, what about some of the other ones? Like I think it was a lady that mentioned earlier about, for instance, like mammogram.
Okay.
That was for 90 days. I had an appointment, family emergency came up, and I had to cancel.
Okay.
So I rescheduled it.
Uh-huh.
And not knowing it was for 90 days, went for my mammogram, and they say, I'm sorry, Mrs. Walker, yours has expired. So I had to go back through the whole process again. So
Okay.
how can we get an extension on some other ones? Not necessarily a year,
Yeah.
but like smaller, like 6 months.
Let me see what I can find out from our central office leaders. They make that decision, not me. Yeah, but thanks. That's a great. When you guys give me this kind of stuff, then I can run with it to someone else and say, hey, this veteran told me this. This is the veteran saying this, not us. So thank you. All right. Looks like we have one more question. I see folks getting up and leaving. I want to thank you guys for coming. Thank you for the positive comments. Thank you for the positive feedback. Thank you for the assisting questions. I mean, you're like genuinely trying to help out your VA. So I really appreciate that. And we're going to continue to do that as long as you do, as long as you guys keep coming back. So thank you so much. And I'll see you next quarter. I don't know where yet or when yet. What am I missing?
Just going to say there's a persistent question that keeps popping up in the chat. Why
Okay.
should veterans choose the Atlanta VA given all of your problems?
I would say you don't have to choose us. I would say that the VA is set up so you get to choose where you want to go within the confines of what Congress has decided. So Congress has made the determination that you will come to us unless something meets that need in the community. And then I am not opposed to the community. My wife and kids get their care in the community. So that is definitely an option for everybody, right? As long as it meets those standards that Congress has given to us, right? Way long ago when the secretary first got into office, we had a visitor from DOJ, right? The office that was trying to make everyone more lean. And they asked me, what do you think? What would you do as a veteran? What do you think we should do as a director? And I said, I personally think every veteran should be given the option to go when they want, where they want, period. I don't think it should be reflective on 28 days, 30 days, 15 miles, 30 miles, 60 miles. I think that if you really enjoy that provider who works down the street from you, you should have that option to say, this is a provider I'm going to go to. The challenge is, believe it or not, there's some tough, crooked people in the community. And we get billed for stuff that is not necessary for you, and then we find out 5 years later and we get, that provider ends up going to jail and whatnot. So I know there's some challenges there, but I do believe that that's where the secretary's headed, is how do we give you the choice? How do we give you the option to be successful? Here's one number that I'll share. 96%. 96% of the veterans who are told you can go to the community still come to us. 96%. So if I gave every single one of you a card today and said, go wherever you want, math, history says most of you are still going to come to me. And we know the reasons why, because it's the only location where you can come and get your dental, your physical therapy, your mental health, your primary care, your surgery, your dermatology, your whole health, your nutrition, you can get everything in my healthcare system almost. Everything. But if you go to the provider in the community for primary care, where's he going to send you to dermatology? Well, I know somebody who knows somebody. Why don't you go find the person yourself and then schedule your appointment yourself and then take care of it yourself? So that's the true difference. So for the folks online, why would I choose the VA? I'd say we have some of the best quality in the country. I'd say we're willing to work with you. We help partner with you. We provide really good care coordination. Now, I only hear about the problems, but how many of you can go to the community and get care coordination across all those continuums? Nobody. It's not offered in the community. You can't get that care coordination. Yes, there's some really large networks out there, especially in Atlanta, where they've got providers all over the state, but all of the services that we offer is really the difference. Thanks, Chanel. All right, really appreciate you guys. Thanks for coming. Hope you all have a great weekend. I was sharing earlier, my daughter's got her homecoming dance tonight that I'm going to try and get some pictures with. She's only in middle school, so don't clap nothing. This is not good news. This is bad news. It's middle school homecoming. Who does that? All right, thanks everyone.